Welcome to Entheo Hour. I'm your host, Chaley, and today I'm joined by Dr. Alessio Luinetti, a board-certified psychiatrist, veteran, and co-founder of the Zephyr Collective, a licensed psilocybin healing center in Centennial, Colorado, which is near Denver. Dr. Luinetti, thank you for your service and also thank you for being here today.
Hey, thank you for having me. I am very excited to talk about this topic because this is a part of my personal journey. And also, it's a topic that I'm pretty happy to share since I've overcome some difficult times. And I think I'm in a good place now to discuss. I joined the Air Force for a variety of reasons, but ultimately, I'm a physician and I wanted to practice to the full extent of my abilities and to help people. And so because of the restraints and the confines of the military system, sometimes you run into hurdles and what you can and cannot do. And so eventually was to me a mismatch of what do I want to do with my practice, right? As a psychiatrist. So I found in personal research and in academic papers, that psychedelics are really called to me. I found also to be the opposite of the system that I was in, and so I was really drawn to it, both professionally and personally, and then it helped me start a new phase in my career, and I feel like I kind of reset to a way that I was before my training. So the personal journey, it was more of a reset to basics for me of what I perceive myself as a person, as a physician.
Wow, that's powerful. Thank you for sharing that. So it helped you personally in your own life, in addition to the research that supported, like the research got you curious, but your own experience is where you had that profound change back to yourself.
Yeah, absolutely. And I think I'm lucky enough to live in Colorado where there are lesser restriction because of the decriminalized model that we voted for here. And so there is more of a community and cohesive understanding and acceptance of psychedelic medicines than probably other states.
That brings us perfectly into my next question, which we are standing at the intersection of the medical model versus this traditional healing method. And as we move from this unregulated psychedelic landscape into the legal regulated space, how do we integrate medical safety without disenfranchising the traditional healers who kept this practice alive?
Yeah, I do believe that in Colorado, there was really a best effort by the legislature to make the medicine accessible and allow for, you know, a more controlled and regulated model while still trying to respect the tradition. And because the focus in Colorado is natural medicine, right? It's not synthetic medicines. So I think that's a really important. And it's not just psilocybin, it's also other medicine that are coming online as part of the legislative process. So you're still allowed to continue to practice traditional ways of healing, but you can also do that more in a regulated and medical model, and that's what I'm more oriented to. But you still run into the limitation of licensing, regulation, pricing of the medicine, and local zoning and restriction laws. So it really all comes down to understanding what the medicine brings to the table and what it can do for you and for your patients. So, as a medical provider, as a psychiatrist, I do understand the gamut of mental health and diagnosis, but also the faults of the system that sometimes I practice in, right? So I see my role more of the bridging the gap between, the medicine to the general public and really understanding how psilocybin interacts um, with psychiatric conditions and the medications that they're on.
Thank you. You've spoken about psilocybin not as a panacea, but as a tool for healing. How does looking at this as a tool change the way a medical provider approaches a patient's treatment plan?
Yeah, so like as a premise, I look really at the medicine and in this case psilocybin through the lenses of my training, because I am a physician, I'm a doctor, and so I'm wary of the bounds of my training. Uh, and to some extent, psychiatrists are perceived as, we just prescribe medication, we peddle medication, and then we don't do any therapy. I don't think that's the case. A lot of psychiatrists do therapists, and maybe there was a trend in the past few years where, like, the field of psychiatry has shifted away from the practice of doing intensive psychotherapy, and that's really, because of the system, insurance reimbursements, and what you can and cannot do, and ultimately functioning in that insurance-based system. But ultimately, the goal is always to heal, right? This is like what we became doctors for. This is our mission. It's our part of our oath. So I really see psilocybin as an option, and to my patients, it's a tool in the toolbox for healing and for those that are seeking help. And I think that's where there is a little bit of the conflict between traditional and Western medicine. You know, in traditional medicine, psilocybin is a medicine for all, and in Western medicine, we put restrictions to who can receive what, right? And that's not how psilocybin is understood traditionally. But, you know, at this intersect, I'm really bound by my ethics and my training to consciously dispense this medicine. So I don't see myself as a traditional healer. I see myself as a physician, uh, being able to have these medications for patients that, one, I feel that would benefit from it. And also while weighing the risks and benefits of the medicine. So that's kind of like my boundary as a psychiatrist in what my role in this space is, and that's what I perceive my role to be in this space.
Thank you. I appreciate that clarification. And yeah, so as a psychiatrist, do you offer psychotherapy as well, or any kind of integration with your clients?
Oh, absolutely. I think the majority of my practice and time is spent actually doing brief psychotherapy. And I do have some patients that do see me just for psychotherapy, where like there is no medications involved. And I wanted to add, in the context of psilocybin, we do have to do preparatory sessions and integration sessions, right? So that is also part of where uh, psychotherapy comes in. What are your intention for the journeys and what you're trying to achieve?
Hmm.
Your healing.
Is what you're trying to achieve more of like the goal of what I notice there's a lot of resistance about using the word goals when we talk about psilocybin. So I'm just trying to understand when you say what you're trying to achieve, is that similar to like therapeutic goals? And whereas the intention is more how do you approach the journey?
Trying to achieve in your healing process instead of a goal, because you never know where psilocybin takes you in your journey. And so you don't want to put too restrictive of boundaries on the medicine. We're like, I want to forget my trauma from 1984, right? That's not where psilocybin works. You have to be able to be flexible and go with the medicine. So, but there needs to be intentions and yeah, goals toward what you would like to heal from, but not make it too
Mm.
specific.
Yes,
Right.
thank you. So there's a common belief in the psilocybin world or the mostly in the underground that you have to be completely off your SSRIs in order to have a psilocybin journey. But research and experience may suggest otherwise. Can you take us through how psilocybin interacts with these medications?
Yeah, so psilocin itself, it's the active metabolite of psilocybin. So that is a powerful partial agonist at the serotonin receptor, more specifically the 5-HT2A receptor, whereas SSRIs act on the serotonin transporters. So what they do is they increase the serotonin available in the synapse over time, and also over time there is a down regulation of the receptors itself. So that's why there's the potential idea and theory that the receptors themselves are less responsive to psilocin. But emergent studies have shown that there is potentially a blunted response to long-term use of psilocybin, but there are so many other tryptamines and factors in the psilocybin experience that void that. So you're still bound to experience the medicine and provide and reinforce its therapeutic effect. Whereas like coming off an SSRI or down titrating an SSRI might actually be more detrimental. So I think the consensus now is that you can stay on your own dose of SSRIs, obviously talk to your provider and your prescriber and trying to find the regimen that is not going to impede the journey. And so that's where the role of prescribers that are trained in this medicine can help kind of navigate those like clinical questions. We can act as consultants to other practitioners too that are not as familiar with psilocybin.
Oh, 100%. That is so needed. So I'm so glad you're here as well for facilitators to consult with on medications, because it's not uncommon to see people come in to experience psilocybin assisted therapy with a list this long of medications they're on. And as a non-clinical facilitator, I'm comfortable with one or two medications. When I see a list like that, it's a little bit beyond just a consultation.
Yeah, absolutely. And under the Colorado requirements, if a client or participant is on medications, psychiatric medications of pre-existing mental health conditions, they need a psychiatric clearance and a medical clearance. So that's already built into the framework. So this is like where there are a lot of like physicians, nurse practitioners that are coming online with this training to provide that consultation service.
Wow, that's just gonna really make this such a safe and well-utilized practice. Thank you. Yeah. As a board certified psychiatrist, what would you say to your fellow doctors or clinicians who are skeptical about psilocybin or who still view it through the lens of counterculture rather than clinical science?
Well, ultimately, I'm an MD. I'm trained in a rigorous academic environment. Medicine to me, and it's at its core about innovation, right? Trying to understand through new research and through rediscovering and understanding concepts that were present all along in medicine. So I feel like sometimes we overlook the natural world in terms of what it can offer. About 5% of all drugs that are FDA approved are used as unmodified compounds, right, from the natural world, and about 50% are derivatives of natural compounds. So nature is providing with the foundations of a lot of the medicines. So I would say read the evidence, look at the studies, and it's not for everybody to get into this kind of work, especially as mental health providers, we're trained to be in difficult situations, and especially when it comes to emotional states that are unusual, and And so it might not be for everybody to get in this kind of work because psilocybin does unlock those like really powerful emotional states and somatic states. But for example, like psychedelics was one of the biggest topics at the American Psychiatric Association annual meeting this year. So definitely there is a drive there, especially with all the statements in the administration about, rescheduling and deregulation of these medicine. Um, and the medicine itself, really, it's only part of the healing process. I think that's where the true healing comes in, is through the prep and integration. What you make out of the medicine afterwards.
Yeah, I appreciate you saying that. I think that goes a long way.
Yeah, and I just wanted to add, that psilocybin itself, it's a catalyst for change, right?
Absolutely. I think that's the best way to put it. So, your healing center, the Zephyr Collective, has a beautiful mission statement, healing the healers. Why did you choose to focus specifically on medical providers, and how can psilocybin help other doctors and people in the medical field?
My partners and I, come from very different clinical backgrounds, but I think we all experience like extensive burnout and challenges when trying to provide, mental health services for so long, right? And especially within maybe the confines of a system that does not allow for true healing. So we really wanted to create a space where like other providers can help heal others and also help them heal themselves and recharge and rediscover like purpose in their career. So we want them to feel like empowered to be true to their mission and their calling and the reasons why they became providers and healers in the first place. So kind of going back to their roots of their training. Yeah.
I like that. I've seen impressive research out there too of what psilocybin can do for people in the healthcare professions experiencing depression or burnout. As we spoke about earlier, Colorado has adopted this broader access model, but states like New Mexico and New Jersey at this point appear to be taking a strict medical approach, restricting psilocybin access to specific diagnoses like PTSD or treatment-resistant depression. As a medical provider, what do you see as the major strengths and limitations of a strict diagnosis-only model?
I think like we all to start from somewhere, right? In terms of like providing this service, and providing the service allows like the states to collect evidence in terms of like the response rates and the adverse effects. And so if that's what the voters supported for that state, at least they can get the research started and get the numbers to show that this is a safe medicine, right? This has been practiced for thousands of years. So when you're taking it under a more controlled and a regulated model, to me, it can only be even safer, right? Because of the controlled setting environment. So that's what it takes to get the people in power behind it, especially when it comes to helping veterans and first responders. And if that's where they're gravitating their efforts first, that's great because those are the people that need it the most and first.
Yeah, thank you. Well said. As a psychiatrist who has a thriving practice and already works with ketamine, how do you see the distinct therapeutic and biochemical differences between ketamine treatment and a psilocybin journey? And how do you determine who's a good fit for each?
So yeah, so in our clinic, in our Centennial Clinic, Zephyr Behavioral Health and Wellness, which is a separate entity from our healing center. Our healing center is co-located, but because of legal reasons, it's a separate entity. We're full scope psychiatry practice, so we provide TMS, we provide therapy, medication management, we provide ketamine assisted psychotherapy. So I guess it's a kind of a difficult questions and maybe and topic for another discussion. Ketamine at a certain dosages can have psychedelic-like effects. It's not a true psychedelic, but it's again a catalyst for change in that narrow neuroplasticity window that it offers. And so when you combine that with psychotherapy, it can really prime people for positive change.
Mm.
And also, it's a more accessible medicine for a lot of people just because you can go through insurance for reimbursement. And so it kind of lower the cost of the therapy itself.
That's important. Yeah, thank you for letting us know about that. So
Yeah,
before I wrap up, I just want everyone listening to know that we'll have links to Dr. Alessio's psychiatric practice and the Zephyr Collective down in the description below. And Alessio, for those who want to learn more about Zephyr Collective, specifically, when is your grand opening? And what can people expect as you begin welcoming them into the center?
so we're really excited to be opening our location in August of 2026. So after that, we'll start to enroll patients. We already have a few clients that are already interested in the journeys. The first step is really to reach out and make sure that you're a good fit for these services, and then we'll walk you through the whole process.
Awesome. Dr. Alessio, thank you for joining us today. And I want to thank everybody who's listening. If you enjoyed this conversation, please like, subscribe, and share it with someone who might benefit from it. And we'll see you next time on Entheo Hour.